My name is Talya Shaulov. I'm a gynecologist. I work at the CHUM and at OVO Clinic. My subspecialty is reproductive endocrinology and infertility. What I love most about my job is really working with women and following them throughout multiple stages of their life. I find that very special.
Hi, my name is Sarah Beaudry. I'm an organizational development advisor at Beneva. I'm also responsible for the health and wellness program. I love helping people out so they can be happy at work and also in their personal life.
You have questions?
What are the first steps in raising menopause awareness?
Is talking about menopause at work still taboo?
How can I help my employees going through menopause?
We're here to answer them.
Hi, welcome to the Beneva podcast, Ask the Experts. I'm your host, Catherine Duranceau. A sensitive topic that is rarely an open discussion, but that every woman experiences is menopause. 10 million Canadian women are going through menopause as we speak, and it's still taboo. Gladly, we feel a shift in many companies that want to be more inclusive and start the conversation for the well-being of their employees. And that's exactly what we're going to do right now. Let's dive into the core of the topic. Talya, explain to us, what is menopause exactly?
So menopause is really a universal physiological phenomenon that a woman will go through around the age of 50. That's the average age in North America, which is defined precisely by the absence of menstrual cycles for a period of 12 months, but can be preceded with multiple changes, which we can discuss. And once a woman is menopaused, she is then menopaused for the rest of her life. So it's kind of her status becomes menopaused.
That is done. When we think of menopause, we think, okay, it lasts for years, but there's the premenopause and the menopause, the postmenopause. Can you guide us through those different phases?
Yeah, so there's that table kind of that we used to follow, which divides the pre and the menopause and the post into multiple different stages. But essentially, menopause can be preceded by multiple years of premenopausal changes, which can be very variable. So change in menstrual cycle pattern to physical symptoms like hot flashes, mood changes, all the symptoms that we can also discuss. And those can precede menopause by about 10 years. So
a couple of years could be actually 10 years before hitting the menopause.
Before hitting the exact menopause date. And then these symptoms can also last beyond, obviously not the menstrual cycle changes, but all the other accompanying symptoms can last several years after the actual menopause date as well. So it's not a one-day phenomenon.
No, it's a transition for years, like you're saying. And some women could have a premature menopause. Now, I'm curious. I read that a Hollywood actress started to have those menopause symptoms around 36. When is it considered premature menopause?
In kind of scientific terms, there's the term menopause, which is normal between the ages of 45 and over. Anything between 40 and 45 is considered early menopause, but still not...
It still happens.
It still happens.
Let's not worry.
And then under the age of 40, it becomes more of a pathological condition, which requires investigations and which really requires a treatment, so hormone replacement, to protect the patient from complications like cardiovascular complications and osteoporosis.
It should be taken seriously. And what are the symptoms of a menopause?
Okay, so the cornerstone of menopause is really hot flashes, whether they be daytime or nighttime. Vaginal dryness, or the term we use to call it these days, is genitourinary syndrome of menopause. So it encompasses all of the genitourinary tract symptoms.
Are those very common?
Very common. About 50% of women will suffer from that during the menopausal transition and beyond, and for which we have very good treatment. So it's important to talk about it. And other symptoms will be mood disorders, so anxiety, depression, or just mood changes, joint pain, decreased concentration, sleep disturbances, which can be accompanied obviously by fatigue and decreased energy, memory loss or memory changes. And I would say that pretty much covers most of the symptoms.
And it seems scary, but not all women have necessarily those symptoms.
That's right. So it's a universal phenomenon, but the experience is not generalizable to everybody. So some women will go through the menopausal transition very smoothly from one day to the next, no more periods and no other symptoms, whereas some women will really have a tsunami of symptoms appear, this wave of symptoms that kind of overtakes their life. So it's very, very variable.
And every woman has different job. We were saying every menopause has different symptoms because we're all, of course, different. Sarah, how does menopause impact women's work and also maybe their careers?
Yeah, well, there's a few ways that menopause can impact their professional lives. So, like Talya said, there are physical symptoms, hot flushes, night sweats, sleep disorder, fatigue. But also we can have some concentration problems. So it can impact your work. There's also, too, maybe decreased energy. So the fatigue that comes with symptom of menopause can reduce your level of energy and your motivation, too, at work. There's also all the time management that comes with that because sometimes we have to go to the doctor, the clinic or something like that. So we need a little bit more time to go to medical appointments. There's ways that menopause can affect the work, yeah.
Well, I think women in their, 45 to 55 age category are really in the peak of their careers. Their children are a little bit more grown up. They finally have more time to dedicate to their jobs. They hold more senior positions and senior roles in companies. And these menopause symptoms, this new wave of symptoms that all of a sudden, kind of attacks them out of the blue, can really hinder their professional development. Mm-hmm. It's not the case for everybody. So some women will go through it and their professional careers are not at all impacted, just like their personal lives are not impacted. But the ones who are really feel the heaviness of the symptoms will definitely feel it in their professional lives. And so much so that some of them have to cut back on work, have to decrease hours, or completely, change jobs, quit their job, change their jobs. So it's very well documented that it can have a serious impact on their career.
Yeah. And do women still feel that it's an off-limit topic and are frightened to break the silence surrounding the menopause?
I think, yes, it's really going to depend on the work environment too. So at Beneva, we try to do some education, to have an open communication on this topic because it's really important for us. We have more than 60% of all of employees that are women. So it's a big topic for us. I think with the education, like I said, the communication, maybe manager training too, that they can be able to give support and know what all the symptoms that they're
experiencing.
Yeah.
Because some women don't even know, so we can't blame the managers for not knowing.
Yeah, that's right. So I think the best thing to do is start with that. And after that, you can maybe create support network. So yeah, but the first thing to do is really to talk about it just to break the taboos.
And I guess there are some small actions that employers can take to change the environment and help them go through the process. What could they do? Yeah,
well, it can be really simple. It can be a little bit more flexibility on the remote working options. It can be also just to install fans or regulate the temperature if you're in a room with a lot of person. Can I open a window? It can be simple as that. And just to give information too, just to let know what are you going to go through if you have symptoms and everything. And at Beneva, we install rest cabins. Yeah, it's like a big box. Inside of that, there's a couch that do massaging. Inside of the cabin, you have light therapy too. You have meditation. And
can I go?
Yeah. I think so.
Try it out.
So. And you can be in a zero gravity position on the chair. So you floating like astronauts in space. So it's really comfortable. So all the stress goes away and you can disconnect for 15 minutes and you come back after that and you're like, oh, wow, that feels so good. So,
that sounds amazing.
Yeah, and that's offered to all of our employees. Everybody can go and that's benefits for everyone.
So firstly, I think it's important to say that everything that Sarah mentioned is very well documented in the literature. These are not benign things. They're really important and they can really change a lot for the women. As employers and managers, I think it's really important to sensitize these people. So through whatever it is, workshop and courses and educational tools, but for them to develop the empathy a woman who has a 25-year-old manager or a male manager, these are people who will either don't know menopause themselves yet or will never undergo it themselves. So I think the empathy that a manager can feel to, for example, a woman who's pregnant or a couple going through a separation, it can make a world of a difference for that person. And I think it could really make a difference for the woman who's going through menopause and going through that transition to feel like a human support, like a very humane support could really make a big difference. And I just wanted to mention also that work is a really rewarding part of a woman's life, and it's a really important part of a woman's life. And I think for employers and managers, it's really important to remember that and to work from that. So menopause is not the time to tell a woman, okay, well, we're going to cut by your hours by half and come back when you're ready.
So you don't feel well, just stay at home and do 15 hours instead of doing 40.
Exactly. It's an opportunity to make her feel good, to make her feel like she's supported, to make her feel like there's going to be changes in place and policies in place to help them go through that. But to preserve their self-esteem is really important, and that also impacts their experience of menopause as well.
Can it change their symptoms?
It could also change their symptoms. So a woman who's feeling less stressed out will feel more kind of comfortable, can be less impacted by the symptoms of menopause. So it's kind of a two-way street.
Wow.
It's really important kind of for this environment to be the kind of the case at work.
So feel supported is not taking away responsibilities because, you won't be able to work. That's not it.
Exactly.
Wow.
It's really to promote professional development, and through that you'll be building a woman's self-esteem. A woman who's suffering from hot flashes can often really feel like her self-image and self-esteem are affected. And so I think that
literally
it's
there may be sweating.
Exactly.
You feel different.
Exactly.
So, wow. And is there a difference with the socioeconomic background, also the cultural backgrounds? Could you tell us a little bit more about that, Sarah?
Yeah, of course. There's still cultural taboos around the menopause, so it's really going to depend on the culture. So that's the main idea, to talk about it and to break some taboos and stigmas around that.
But I'm curious, are there some communities that see menopause as like an aura? It's impressive.
Yeah. There's a culture that's really like a big step. And when the woman is menopaused, they're gonna help the young ladies to go through like their first period and help them to go through that phase and give tools how they're supposed to feel and everything. So they're really going to be there for.
So you feel the community.
Yeah. It's really they talk really about it. So it's really different on every culture, yeah.
Absolutely. We should be inspired by those cultures.
Yeah, of course, yes.
Different women will also kind of go through menopause very differently. There's different factors that will affect menopausal symptoms, the severity and the timing of it. So socioeconomic factors, ethnicity. We even see that women who work certain types of jobs will have different symptoms and earlier menopause. So for example, people who work night shifts, like nurses who work night shifts for like 10 years.
And that are doing a job so hard to do.
Exactly. That's so important.
Yeah.
We'll sometimes see symptoms appear earlier. So there's a big influence of environmental factors on our experience of menopause as well, for better or worse.
And how could they, let's say the hospital, in the case of a nurse, help them out so that they have concrete actions to accept it? What could
I think all the things that Sarah mentioned are really important to all work environments.
Yeah.
The hospital happens to be one where it's sometimes a little bit more difficult to implement these things because of the high stress feature of the job. Like nurses and other healthcare professionals in the hospital are always on the go. There's no time for breaks. Your break is much less important than the patient who is having a heart attack right now. So I think there is work to be done, and there's huge leaps that are happening in this domain.
Absolutely.
But it's in all these domains where the job is extremely hands-on. It's not less important to really address the issue.
It should be taken seriously.
It should be taken seriously.
And have those concrete actions even while working
in a high-stress environment. Exactly.
Oh, yeah. So Beneva did a survey, and you got lots of great answers. Tell us more about that.
Yes, we did a survey on organizational health. So that showed us a lot of women were very interested in menopause. So we already did some intervention, like a conference. We put tools on our intranet too. And we also have Office Vibe that they call, which evaluates the level of wellness and happiness of our employees. So we can adjust our intervention too according to this data, just to make sure we are on the right track, to make sure we did the right thing to respond to the needs of our employees.
Absolutely. Talya, do you have an anecdote to share with us that really struck you?
So in line with kind of the topic today, I had one patient who came to see me a couple of years ago. She was going through a really tough menopausal transition, and she was having extremely big symptoms, substantial symptoms that were impacting her personal and work life. And she came to me saying, I need a break from my work. I need to reduce my hours. I need to work more from home. Can you fill out my insurance papers? And I was very taken aback by the fact that she brought me these, that she wasn't even comfortable speaking to her employer about it. I kind of felt uncomfortable filling out this form. And, the questions these insurance companies often ask are really specific to like physical limitations and mental limitations. And I didn't feel like she filled out any of those categories. It was just simple things that she needed in her job to be able to help her do her job better, and in a time where she needed a little bit more support. And so that's when I kind of realized, wow, we have work to do in the workplace.
That is kind of strange. We should be able to have the conversation without saying, hey, I've got my doctor's note. Can you approve that I adapt my job?
Exactly. It's funny because menopause is a medical condition, but it's not a disease. That's kind of what needs to be destigmatized in a way.
Did you have lots of patients like that?
No, thankfully no.
Good. Thankfully no, absolutely. We always like ending the podcast by having a short recap of our conversation. Sarah, can you sum up the most important points we discussed?
Yes, of course. Well, as we said many times, the symptoms of menopause are different for every woman, which underlines the need to avoid any generalization or labeling of those going through this phase of their lives. Maybe to promote open-mindedness in the workplace and initiate an inclusive dialogue, give some tools, information, resources that an employee can work with, deconstruct all the prejudices that can be there, and show empathy. And remember, all of the small gestures can make a difference.
Thank you, Sarah and Talya, for engaging in the conversation. Talking about menopause will break taboos and will slowly help women embrace it instead of fearing it. Thank you all for listening. If you have any questions, please don't hesitate and contact us at podcasts@beneva.ca. If you would like to have more information about this topic and discover other episodes, we invite you to go on Beneva's website in the podcast section. Stay tuned for another conversation that will guide you for future insurance and business needs. Until next time.